Hello, everybody. Who's watching this video or recorded version? My name is Isak Kim, and I'm an assistant professor in the Department of Counselor Education at the University of Iowa. Um, I know I said good morning because it's 11 a.m., but I also know that those in Korea, you're in like 1 a.m. Anyway, I'm very happy to be here to join this international conference co-hosted by 성균관 University Traumatic Stress Center and Ajou University Quality of Life Research Center. I'm honored to present this topic of research, one of the recent publications. So today's topic is understanding the parents of non-suicidal self-injury, NSSI, among Korean youths. And here's some background and context information. NSSI, I'm going to call it NSSI instead of non-suicidal self-injury because it's a little bit long. So it's been becoming a serious public health concern among adolescents. I think not in just in Korea, but also in the US and other countries too. So it's kind of global phenomenon. It involves deliberate harm to one's body tissue without suicidal intent. So when I first came across this terminology, NSSI, I got a little bit of confusion because of the terminology itself saying like it's non-suicidal. And at the same time, research supports that it's one of the most significant risk factors for suicidality. So I was thinking like, is it suicidal or non-suicidal? And that confusion may come from because NSSI, the term was developed and used for diagnostic definition. But in clinical reality, again, NSSI is a significant risk factor for suicidality. But it's not necessarily a paradox because of the level of analysis. Like when people have an intent to kill themselves, we can consider that as suicidality or suicide attempt. And when they don't have an intent to kill themselves, but still doing some behavior to injure themselves, that's been categorized as NSSI. And understanding how users they engage in NSSI is really important issue for prevention and intervention. And here's a more in-depth conceptual understanding of NSSI. And we know even under any maladaptive behavior, there's always reason and function. And of course, NSSI serves multiple functions. So first, for some uses, like it's a way of regulating overwhelming or negative the emotions when they don't have like other safer and adaptive and healthier coping skills. And for some other people, like it can be a kind of self-punishment, especially when they have a very strong sense of guilt and shame, and they want to just kind of turn those anger, guilt, and shame inward by punishing themselves. And sometimes it's used as a communication of distress. That being said, it's a way of explaining or giving off, signaling their pain when they don't have the capacity to express their emotions in a verbal way. And these functions are not necessarily and mutually exclusive, but sometimes and often frequently overlap within the same individual. And I also know some cases they are using this method and behavior as a way of seeking attention from other people. And then some even report using this method, NSSI, as a way of connecting and increasing the sense of social bond with those who's using the same way of emotional regulation coping skill. So it's not a single behavior or method. So there are multiple methods like cutting and hitting and burning and scratching and pulling hairs a lot of different methods. And these methods tell us something about some underlying function and emotional state too. So instead of just rather than simply counting incidents, how many times, like frequency and how severe what that was, we wanted to look at the patterns, how the heterogeneous patterns show up out of those different methods. So here are some research gaps. So there are only few studies that have examined heterogeneity in NSSI methods, and even fewer have used person-centered approach like latent class analysis that we have used in this study. Um, Person-centered approach in as a way of methodological approach is not just talking about like Carl Rogers person-centered, of course, but it's the opposite concept of variable-centered approach. So when you're using the frequency as a of NSSI as a continuous variable, that's one of the examples of variable-centered approach. But we wanted to see and use some subgroups and subpopulations or parents or classes of those NSSI methods. So we're arguing that we have used person-centered approach in that sense. And limited research has explored NSSI among Asian youths, especially Korean youth, using that person-centered methodology. So here's specific study purpose and research questions. So purpose is to identify distinct patterns of NSSI among Korean youths and examine associated predictors and some group differentiated outcomes by those classes that we identified. So the research question number one, what heterogeneous patterns of NSSI methods exist? So identifying the heterogeneous patterns of NSSI methods. And number two, what social demographic and clinical factors predict these patterns? Number three, how do psychosocial and clinical characteristics differ across these classes? Here's a little bit of conceptual framework. We did draws from developmental psychopathology and trauma framework. So we did approach this study from a trauma-informed lens and recognizing that trauma can serve as one of the predictors for those NSSI methods. We also did draw on the idea of cumulative adversity, but we did position it within a broader cumulative disadvantage framework. There's a theory named cumulative disadvantage framework, and the assumption of the theory is that self-injury does not just result from one traumatic incident or experience or exposure, but from a accumulation of stress and disadvantage. And there can be multiple mechanisms that can explain how those cumulative disadvantages and adversity and traumatic experiences can contribute to those NSSI. For example, like, yeah, as a way of regulating those emotions coming from those stressors and life challenges. And also, and regarding methods and participants, we had a pretty large, good amount of community sample of Korean youths who had engaged in at least one NSSI incident. And the higher proportion of the sample was female participants. That's reflecting the both platforms, demographics, and broader like gender trends in NSSI research because we used a online community platform for adolescents and youths to share their emotional concerns. It's a mobile app too. And for the age range, we collected data for early to late adolescence. Age level was 9 to 24. This age group and range may be a little different from the traditional understanding of youth population because in many other research and literature, youth is defined as 10 to 24 or 10 to 25. But in the Korean context, because of the Koreans use Basic Act, they define adolescence as and youth from the age to 10 to 24. No, 9 to 24. That's why we defined this age group for study sample. And again, yeah, majority of the sample was female participants. We actually did acknowledge that as one of the limitations and cautions when we do interpret the research. But it's also true that female adolescents and youths, they are more likely to show NSSI as their maladaptive coping strategy. In terms of the procedure, we used online anonymous survey design. And because of the very sensitive nature of the survey items, including NSSI and other clinical outcomes, and so yeah, the study was conducted anonymously in online spaces. No identifiable information at all. So that allowed participants to share openly about their experiences. And we obtained informed consent and confidentiality was ensured. Participants completed validated measures on NSSI, trauma, and psychosocial outcomes. I'm going to talk a little more about those measures. An ethical approval obtained from the Institutional Review Board. And here are more specific information about measures. The most important measure in this study was, of course, NSSI, and we used functional assessment of self-mutilation, FASM, adapted for Korean context. We didn't validate the measure, but in a past study, they validated and already adapted in a cultural context of Korea. So the original items includes cutting, hitting oneself, pulling out hair, tattooing, picking at wounds, burning, inserting objects under the skin or nails, biting, and picking at areas of the body, scraping skin, and erasing skin. But the Korean version, three items were removed that I indicated as italic and bold. So tattooing and picking at areas of the body and erasing skin were removed. And rather than that, pinching skin was added because of the cultural context. So specifically, like the prior research explained that tattooing is not strongly related to self-injury in the context of Korean culture. And then the skin picking and erasing, they are also considered symptoms of another disorder that's known as excoriation disorder. So that's why those items were removed. And we include only 8 items and methods of NSSI. And we included predictors for the classes as traumatic event history and psychiatric treatment and social demographics. And some outcomes for NSSI severity. I mean, they are not necessarily outcomes of the patterns of NSSI, but we did group differences by those classes for these variables. So what kind of group differences are there by NSSI classes? Yeah. For NSSI severity and suicidal behavior and self-esteem and automatic negative thoughts and body investment. And we used latent class analysis using M+. The code like R3 step and DU3 step are for yeah predictors and for analyzing distal outcome comparisons. And we identified four class solution was the best fit considering all the model fit indicators. Um, as shown in this table, AIC and BIC and adjusted BIC are all indicating that four class model is the best fit model and also having the highest score of entropy, which is better when it's getting closer to one. And BART was also significant. So we concluded that the four class model is the best fit. And here is the main results for NSSI classes. What's interesting is that each group reflects a kind of different levels of behavioral and methodological complexity and psychological risk. As you can see, the first class, skin damaging group, they were those who engaged like primarily in minor types of skin damaging behaviors like picking and scraping, and later they showed lowest severity and suicidality. And the second class was hitting and cutting. Um, and cutting is more salient and prominent in this group. So yeah, universally reported self-hitting and occasionally cutting. And they showed some moderate levels of emotional distress. And the next class is cutting. And as you can see, they exclusively used cutting method without any other noticeable methods. And they showed quite higher psychological distress and negative self-image. And the last one, the color light blue, is called multiple methods. And obviously, they used more and multiple and diverse behaviors and methods, such as cutting, hitting, picking at wounds. I'm only mentioning those methods that's hitting over zero point 0.5 in terms of the probability. So cutting, hitting, picking at wounds, and biting and pinching, and even scratching. Yeah, it's pretty understandable that they show the highest risk across the clinical outcomes like severity and suicidality and cognitive distortions, those automatic negative thoughts. So yeah, I think this chart well demonstrates that the heterogeneity of NSSI methods and showing the different classes and patterns and profiles here. And in terms of the predictors of class membership, past trauma exposure significantly predicted class membership. For sure, basically speaking, the more trauma exposure they have, the more severe NSSI cluster they belong. And also prior mental health treatment, like visiting psychiatric services, that was also a key predictor. But social demographic factors such as sex, age, SCS, they were not significant predictors. For the last research question, we examined group differences by classes, and there was quite clear, not all the time consistent, but like pretty clear severity gradient from class 1, like skin damaging, to class 4, multiple methods. And multiple methods class showed highest NSSI severity, suicidal behavior, automatic negative thoughts, and social exposure to NSSI. And lower self-esteem and body investment were observed in classes 3 and 4. And these are some more specific outcomes for the group differences. So here's a summary of the findings. NSSI behaviors, they were heterogeneous and it's not uniform, which indicates that we need to advance the literature by looking more at the methods and its patterns, not just frequency or severity of the NSSI. And trauma and treatment treatment history differentiated engagement patterns, and multiple NSSI methods signal elevated psychosocial and clinical risk. And given that this study targeted Korean youths and cultural context may shape both manifestation and interpretation. I recently found one another study who targeted Chinese youths, and they showed quite similar patterns, especially for those who showed multiple methods in terms of NSSI behavior. So there should be more studies and research findings that can support this kind of categorization and understanding. Here are some implications for practice. So we want to consider using and utilizing screening tools that assess method diversity, not just frequency. So not just asking like, have you done NSSI before in the past month or past year or past 2 weeks? But more than that, right? We can ask more diverse methods and how those methods are patterned because those patterns talks a lot about that. Not just severity, but also some indicators for clinical outcomes. And given the significance of trauma exposure in terms of its predictor for NSSI classes, we also should be trauma informed when dealing with adolescents and youth population who's showing and reporting NSSI behaviors. And school-based programs or other clinical programs, they could integrate body image and cognitive restructuring elements because they are also have shown significant group differences by the classes. So in sum, our findings highlight the importance of trauma-informed and culturally responsive and sensitive prevention and intervention strategies. Here are some limitations and future directions. So the data was cross-sectional design, which is limiting causal inferences. So even though I have been using the terms like predicting, it doesn't necessarily predict and ensure causal inferences. That said, longitudinal research design may benefit. Uh, Female dominant sample that might have reduced generalizability, reducing validity of the study. So we want to use more gender balanced sample with more and diverse and balanced socio-demographic characteristics too. Data from an online community may introduce self-selection bias and future work, again, longitudinal data and gender balanced and multi-method study would be great. So here's a conclusion. We identify four method-based, not severity or frequency, but method-based NSSI patterns among Korean users. And findings underscores the need for pattern-specific and trauma-informed care. And we also want to actively consider cultural context that can guide screening and assessment, prevention, and intervention strategies. Thank you for listening. And again, thank you for having me here and giving me this opportunity to present.